For transgender kids and their families, access to individualized treatment can be hard to find. Welcome to the GW Healthcast. I'm Melanie Cole, and today we're speaking with Dr. Jerry Chow. He's an assistant professor of plastic surgery at the George Washington University School of Medicine and Health Sciences and is affiliated with George Washington University Hospital. Dr. Chow, explain a little bit about transgender care in this country and how it's typically been treated. On average, how many kids struggle with their identities?
Sure. It's a challenging question because a lot of studies have conflicting numbers in terms of epidemiology. So studies range from incidence of anywhere from 1 in 10,000 to 100 and 1 in 200,000 individuals who may experience gender dysphoria. Now, it's important to know that gender dysphoria itself is a very broad spectrum, and it's a broad spectrum of ways in which individuals express their gender identity. So, in general, it refers to any sort of discomfort that an individual feels, which is related to a discrepancy between their gender identity and that gender that was assigned at birth. And a lot of the manifestations in that and treatment of that may be related to physical appearance. So the approach to treatment really starts with a multidisciplinary group, which includes primary care physicians, psychiatrists, mental health professionals. When the patient comes and sees me for surgery, that's usually at a later stage in the transition process, when the patient's really kind of made the commitment to living as that new gender.
Tell us a little bit about the cultural shift, Dr. Chow, that's catapulted the need for these types of services that you're discussing today.
Well, I think a lot of it has to do with the changes in healthcare availability to transgender individuals, and a lot of that changed around 2010 with the Affordable Care Act. Before that, a lot of gender-affirming surgeries, which refer to any surgery that's used to or performed to treat gender dysphoria. Before that, a lot of these surgeries were paid out of pocket by the individual seeking these treatments. And there are many studies that have been performed that show significant improvements in quality of life and ability to integrate socially after undergoing gender-affirming surgery. Now, with the Affordable Care Act, there's language that prohibits any discrimination in obtaining equivalent treatment by any healthcare entity that receives federal funding, which is, the language is somewhat broad. So insurance companies have differing ways that they offer these services to their members, but because the healthcare and insurance world has been changing so much over the past decade or so, that's allowed broader access to things such as gender-affirming surgery. So that's why it's an exciting time in the field of plastic surgery, and it's knowledge and of these services and research into ways to offer these services better to gender dysphoric individuals has been really skyrocketing over the last 5 to 10 years.
Is there an ideal age at which patients should be seen by a specialist, such as yourself, as being crucial to their emotional well-being? And what are some of the challenges that you see most often?
The question of age is a tricky one, and I think that one of the considerations by WPATH, or the World Professional Association for Transgender Health, their standards of care is that patients should, as a surgical criterion, should be of majority age in that particular country prior to, or be able to consent. Now, in terms of when that process has started, there are individuals who may have feelings of gender dysphoria early on during adolescence or puberty, and often those patients do get see mental health professionals and psychotherapists for help with that social transition aspect.
Then tell us a little bit about the assessment and treatments that are offered to patients, and tell us a little bit about facial feminization surgery. What does it aim to do?
So facial feminization surgery it's really not just one surgery, but it's a broad spectrum of surgeries that are aimed to change typically masculine facial characteristics to feminine characteristics. Now, that the goal of those surgeries, or all these facial feminization surgeries, is to allow that. To number one, allow that individual to feel that their physical appearance more matches their gender identity, as well as to allow them to integrate into society more seamlessly and to be able to pass. When we see people for the first time or meet anyone for the first time, there are hundreds of signals that our brains process that tell us whether an individual has a masculine or a feminine appearing face, and we make that decision subconsciously whenever we meet an individual. So. One of the challenges for patients who have gender dysphoria is that unfortunately in our culture, if someone is identified as trans, there can be stigma associated with that, and that person may be subject to harassment. So these surgeries can often have a very significant impact on that person's quality of life. Now, those surgeries themselves can range from soft tissue surgery, such as skin, and bony surgery, so alterations of the underlying facial skeleton. Now, research has shown that one of the most important areas to feminize the face is the brow region, and that's because the feminine brow is softer and flatter, and men have more prominence of a sinus or a frontal sinus in that area, which contributes to more prominence along that brow bone region. So one of the most important surgeries to feminize the face is reduction of that brow bone. Now, other types of surgeries include, making the nose more feminine via a rhinoplasty, or alterations of the positions of the cheekbone, tapering and softening the chin or jawline, as well as more common types of procedures, such as injecting fillers into the lips to give them a more feminine appearance. But like I said, facial feminization surgery is a very broad spectrum of procedures. And, it's a really individualized approach whenever a new patient comes to see me about that.
Well, there are so many areas that we could discuss, Dr. Chow, but what is this like for the patient? And as we're talking about facial feminization surgery, we'll kind of stick with that. But what is all of this like for the patient and their families to go through? What is recovery like? And how are all of your multidisciplinary team involved in helping along the way?
Well, I work closely with multi-specialty clinics focused on helping the transgender population in the area, and that really helps me with facilitating and identifying the patients who are psychologically prepared and have really made that commitment to living in this gender identity. So, in terms of the whole process, I think it starts with managing expectations. The patients have usually been on hormonal therapy, often for a period of about a year, which helps with certain aspects of of feminizing the face and the head region, such as the hair distribution and the skin softness. However, there's a lot that hormonal therapy is limited in improving or feminizing, and in surgery, I'll admit, it also has its limitations, and there are certain expectations that need to be really laid out for patients in what is realistically achievable with surgery, and I think once those are in place, then I think the patients do very well and have very good surgical outcomes in terms of when the surgical outcome matches a realistic expectation.
As we wrap up, tell the listeners what you'd like them to take away from this segment on transgender medicine in general, and how do you offer support for the parents and the family as well? Kind of wrap it up with what you would like them to know about this field of medicine and what you do.
Well, what I would like patients and families to know is that they don't need to feel alone. I think it can be a very hard for some individuals to find physicians who they feel comfortable and who they feel equipped to take care of them. So, patients may come and see me or other surgeons who perform gender-affirming surgery from far away. And I think that's a lot of that has to do with lack of access to experienced surgeons or physicians. So I would like them to know that there are physicians and surgeons who really have a strong interest and passion for helping this community and improving their quality of life.
Great information. Thank you so much for coming on and sharing your expertise in explaining this field of medicine and the various options and treatments for transgender individuals. Thank you again. You're listening to the GW Healthcast. Please visit gwdocs.com to get connected with Dr. Chow or another provider, or you can call 1-888-4GW-DOCS to schedule an in-person or virtual appointment. I'm Melanie Cole. Thanks so much for tuning in today.